5 things to remember about porcine circovirus associated diseases. So in this presentation we will cover several types of diseases that are all caused by porcine circovirus type 2. However, all of the diseases are multifactorial, so the virus by itself does not cause the disease. We need the virus and additional risk factors like extra stress or environmental issues that are going to make the pig develop the diseases. So porcine circovirus type 2 can really affect all ages of swine. The first syndrome we will be talking about is the post-weaning multisystemic wasting syndrome that affects pigs usually in the nursery and growth finish stages. The porcine dermatitis and nephropathy syndrome that affects pigs in late nursery and throughout the growing finishing phase, and the reproductive form that affects sows and baby piglets. So the clinical signs we can see in the post-weaning multisystemic wasting syndrome are pigs that are going to lose weight, they're going to become pale, kind of anemic looking with a rough hair coat. They're going to be much smaller than other pigs in the group, and what you can see is enlarged lymph nodes. So obviously this will be seen much easier at necropsy, but if you take a pig and pick it up, you can see sometimes the inguinal lymph nodes that are really enlarged, and you can see them between the thigh of the pigs that is alive, In the porcine dermatitis and nephropathy syndrome, well, it is in the name. You can see skin lesions that look like circular, crusty, red to brownish lesions that start in the back legs and the perineal area, and then that progress forward on the abdomen, and at some point may even reach the front legs. At necropsy, you will also see kidney lesions that look like a white spot, area of necrosis on the kidney. For the reproductive form of the disease, we will see late-term abortions in sows, an increased rate in stillbirths in piglets, and when we open up those piglets, we will see lesions on the myocardius of the pig. So we will see petechia and areas of necrosis on the cardiac muscle. The pigs that are born alive are usually looking weak, a little bit like in the case of PRRS with a rough hair coat as well. So these are the signs to look out for, and you can see that they vary quite a bit between the several syndromes. So the diagnosis, because PCV2 by itself is not enough to create the disease, we need 3 type of parameters to establish a diagnosis for post-weaning multisystemic wasting syndrome. You need the clinical presentation, the histological lesions. So in the lymph nodes you have creation of giant multinucleated cells that are non-functional. You will see a depletion in lymphocytes that are really characteristic. In the lungs, you will see interstitial pneumonia as well. But what is really important is that we find the virus in those lesions. Usually, we can detect PCV2 either via in situ hybridization or by immunohistochemistry. This way, we establish that the virus is in the lesion and that the clinical signs are indeed due to PCV2. In the case of PDNS, the clinical presentation and the histological lesions are usually enough to make the diagnosis. For the reproductive form, we will need to have virus in the myocardium of the pig. Vaccination for PCV2 is very effective. It is a DNA virus, so it's pretty stable, even though for the DNA virus it mutated quite a bit. But so far the vaccination has been very effective, so the sows can be vaccinated early in their career as gilts, but mainly we vaccinate the piglets before weaning so that they are protected during their growing phase. But like I said, all of those syndromes are multifactorial, so we want to manage any additional stress, such as high pig density, mixing pigs of different ages, poor ventilation, co-infection with other disease that may be immunosuppressive. All of those need to be managed in order to decrease the occurrence of the diseases associated with PCV2.